Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Imaging. In the imaging, after the first post-treatment scan, imaging, you will do a post-treatment scan. You will have to do a first post-treatment. After the surgery, we can do first scan, which is called as first post-treatment scan. After first post-treatment scan is done, and if the patient is low risk patient, and if you see in the low risk patient, you have seen that there is negative TSH stimulated thyroglobulin is also negative, and there is also negative cervical ultrasonography. In such cases, there is no requirement of whole body iodine scan or radio iodine scan. Okay, so in the first post treatment scan, if you see that it is a low risk patient with negative thyroglobulin levels and negative cervical ultrasonography. In such cases, whole body radioiodine scan is not required. Then who requires whole body radioiodine scan? It is required for high or intermediate risk patients. If the patient is high risk or intermediate risk patients, if the patient has high or intermediate risk of persistent disease, in such cases it is better to do a diagnostic whole body scan is done 6 to 12 months after the remnant ablation. Even after ablating the remnant, we should do a radioactive iodine or whole body scan is done 6 to 12 months after the remnant ablation. Then, in the post-operative scan, the cervical ultrasound. What does this tell us? A cervical ultrasound will mainly evaluate the thyroid bed. Okay, and it will also tell us about the central and lateral cervical node compartments. How are the nodes? Are they okay, or are there any metastasis to the nodes? All those will be set by cervical ultrasonography, and this is actually performed 6 to 12 months post thyroidectomy, because we have to know whether there is any recurrence or any chances of recurrence. If there are any chances of recurrence, in such cases, we will know prior, even before the patient develops advanced symptoms, if we do a cervical ultrasonography. So it is done at 12 months, and at first you do it at 6 months, and then it is done at 12 months, and from there after 1 year it is done annually. At least we should do it for 3 to 5 years. You should do it annually depending upon the patient risk of ultrasound disease. Now, due to any case, if you see that if the radioactive iodine scan and the ultrasound scan of the patient are negative, but the thyroglobulin levels should also decrease, right? But the thyroglobulin levels remain elevated. If radioactive iodine scan and ultrasound scan is negative, but if thyroglobulin levels are elevated at any point after surgery or after treatment, then we should do an fluorodeoxyglucose PET scans are done to localize the disease. Why is thyroglobulin elevated? Definitely there should be a reason. There should be some focal of the disease which is left, so that focus of the disease is localized with the help of FTG PET scan.
thank you and thank you for watching.